Hi, I'm Dr. John Dickinson from the University of Kent.
What is the issue right now with TUEs? What are they for a start?
Well, a TUE is called a therapeutic use exemption form. And what that means is it allows an athlete to use a drug that might be on the ban list therapeutically for a medical condition.
Why is that a bad thing?
Well, it's not necessarily a bad thing because these therapeutic use exemptions are provided for athletes when they have a medical need for them. They're not a ticket for an athlete to use the drug to cheat with. They're there to provide support for an athlete for a medical issue.
Why are there so many asthmatics in elite athletics?
So we know that athletes have a higher prevalence of asthma-related issues in the general population. If we look at the Team GB asthma prevalence, it's around about 21%, whereas the general population is 10%. The reason for that is that the ventilation rates that elite athletes get to during their sport is greater than the majority of people in the general population. So that means that their lower airways have to warm and humidify the air. That causes inflammatory processes in the lower airways, and so they're more susceptible to having a bronchoconstriction, which is basically what asthma is.
What about the athletes who are saying that you're basically trying to force them not to compete anymore?
Well, basically, hopefully one of the good things that comes out of this is if we can actually identify that asthmatic athletes can compete and win gold medals. And so an asthmatic athlete using inhalers isn't doing anything wrong. They are using their inhalers to prevent an asthmatic issue coming on. And there's no evidence that the inhalers themselves used therapeutically, so in the doses that a doctor prescribes, provide any performance enhancement at all. So there's no reason why an athlete who has asthma shouldn't take their inhalers.
So why is there this huge fuss about, say, Bradley, Wiggins and others?
So some of the therapeutic use exemptions have been for quite strong drugs called oral or injected corticosteroids. Now these types of medications are offered to asthmatics when inhaler therapy doesn't touch or doesn't treat asthma when it gets out of control. So sometimes athletes or doctors that treat athletes feel that athletes may need an oral corticosteroid to calm down their symptoms. The question is if an athlete is suffering that badly from their asthma, are they in a suitable state to compete in the sport that they're doing?